Hi, this is Dr. Philip Miller. I'm a facial plastic surgeon here in New York City, specializing in rhinoplasty or nose surgery, specifically changing the shape of one's nose. What type of nasal surgery is there? Well, it's basically broken down into more or less 4 different areas. One of them is the outside of the nose. That's called a rhinoplasty or a nose job, which changes the shape of the nose. The others are more internal or on the inside of the nose. One would be a septoplasty for a deviated septum. A septoplasty involves moving the septum, which is the partition between the right and the left nostril, something you can feel if you put your finger, your thumb and your forefinger inside your nose. You feel a wall between both nostrils. That septum further back in the nose can be shifted to one side or the other. It's deviated to one side to another. So a septoplasty will make that straight. Also existing within the nose are turbinates. Those are organs that are yay long, that go from the front of the nose all the way to the back of the nose. And those are responsible for humidifying, warming, and filtering inspired air. And yet they can get too big sometimes. They can just get really, really large. And they have to be made smaller. So that is called a turbinoplasty. A turbinoplasty will reduce or treat the excessively large or malpositioned or poorly positioned turbinates. Finally, there are rooms, if you will, that come off the nose. Those are called sinuses. If you think of the nose as a long hallway, sinuses are rooms below, between, above, and behind the eye. The function of the sinuses is debatable, but suffice it to say we have them. And so sinus surgery more or less opens up the sinuses so that they can drain more effectively. People with sinus problems, otherwise known as sinusitis, people with sinus problems typically complain of pain, pressure, and recurrent episodes of infection in the sinus region. And finally, I should add another one, and that is nasal valve surgery for patients with nasal obstruction. Many of the things I described already, septoplasty, turbinoplasty, sinus surgery, can all aid in difficulty breathing in nasal obstruction. But another one, which is called valve repair, also allows individuals with difficulty breathing to breathe better. Think of the breathe right strips, the one that goes across the nose. They're surgery to more or less put an internal breathe right strip, one that allows you to keep the middle third of the nose, which if collapsed is difficult, gives you difficulty breathing, but if it's open you can breathe really, really well. So those are all the different types of nasal surgery. I hope that answered your question, and have a great day.